Pallor or paleness of the skin associated with anemia, a condition in which the hemoglobin level is lower than established threshold for the age. Anemia is the reduction of hemoglobin content in the blood. WHO grading for the anemia mild, moderate and severe. HB less than 6.5 is life-threatening. Lines, eyelids and the surface of the eye are conjunctiva. Ask patient to see upward, retract lower eyelid to see lower palpebral conjunctiva. Pull down lower eyelid and compare interior and posterior rim for pale color and the red color. If the interior rim is not redder as compared to posterior rim, then it is called pallor. Protrude tongue to look for the paleness. Compare palms and creases of the palms. Compare nail beds with healthy nail beds for paleness. Icterus is the yellowish discoloration of the skin due to excessive accumulation of the bilirubin in the blood and tissue. It could be hemolytic, hepatic, post-hepatic, pre-hepatic. In adult, bilirubin level more than 2 mg per deciliter causing yellowish discoloration of the skin, and normal is 0.2 to 0.8. Examine sclera, retract upper eyelid and compare both eyes. Also examine nail beds. Cyanosis is the bluish discoloration of the tissues that results from increased concentration of reduced hemoglobin in the blood content. It could be central and peripheral cyanosis. Common sites are lips, tongues, fingers, nail beds and earlobes. Clubbing is a physical sign characterized by a bulbous enlargement of the ends of one or more fingers or toes. Proliferation and edema of the connective tissues result in loss of the normal angle between the skin and the nail plate and excessive sponginess of the nail base. Downward curving of nail, bulging fingertips, nail widening and soft nail beds. You can examine by Shamroth sign. Diamond window is absent in clubbing. Different grades and angle of the finger and nail. Edema is the swelling caused by too much fluid trapped in the body's tissue. The grading of the edema is determined by pit depth and recovery time. This scale is used to rate the severity of the edema in different grades from 0 to 4. There are two main types, generalized and localized edema. Localized lymphatic, inflammatory and allergic. Generalized renal, cardiac and nutritional edema. In edema, examine on dependent part of the bodies. For example, above medial malleolus of the ankle. A temporary depression is formed in the skin only applying pressure for 20 seconds. Depth of pit 2 mm to 8 mm.